I'm feeling quite self-conscious. I'm hiding my mouth behind the microphone because we've got an expert dentist in the studio. Dr. Hakim is with us today, American board certified orthodontist, expert in Invisalign, consultant orthodontist at the Same Day Clinic. And also, we can talk some new research you've been working on to a white paper that talks about this ever-evolving clear aligner market in the region, which we're going to come to next. First of all, how are you, Dr. Hakim?
I'm very fine, Helen. Thank you for having me on your show.
Pleasure. We are talking about younger ones. Your patient age range goes from 6 to 76. But we're looking now at the kind of preteen, teen, and I guess some of the corrective and orthodontic work. Have we seen, and I say this expecting a yes, because of social media, a bit of an explosion in this area of aesthetics and corrective work?
Yes, we have. People are more aware. I think the selfie heralded in a new age where people want to have a very nice smile, and now there are multiple ways of achieving this, and Invisalign being one.
Tell us a little bit about the white paper, the research that you were compiling for this region in particular, which I think is actually interesting when you think about all the diverse nationalities and ages and stages. What did it tell you about the Invisalign system here?
Well, the white paper was primarily focusing on the perceptions of parents for their children to getting aligner treatment. And obviously it was very good findings showing the barriers that parents have erected to prevent their children from having aligners in the thinking that braces or the traditional brackets and wires are more effective, which is not the case.
Well, that's what I wanted to ask you in terms of how do you, as consultant orthodontist, look at a child, and we're talking children really before we even get into teens, and think this is going to be the correct treatment plan? What makes a good candidate for each method?
Well, first of all, what is the reason that the child is there, or what's the prevailing concern? And based on this, then we can formulate treatment plans. In the preteen age group, there is a misconception out there that we should wait, perhaps when the child is 12 or when all the permanent teeth have erupted. And this is actually a fallacy. This is not the case. We have children who are unhappy with the way the teeth look. Unfortunately, bullying happens. Additionally, we have some children whose teeth are in a position that increases the risk of damage due to trauma. If you do school drops, you might find some children who are unable to bring their lips together at rest. So this is something that's there. And then finally, there are things that affect normal growth and development, like habits, like breathing anomalies. Now, this is a big area that's getting looked into. So these are for the preteens. And then based on what the concern is, we provide a customized option to address that.
Dr. Hakim with us today. We're happy to take questions if you want anything to do with, orthodontics in particular, for your child. Maybe you're in the middle of it. What about that, and I asked this because my daughter's 9 and she's got friends in her year group, the year above, who've had, the braces, the wire. And I must confess, I was like, oh, that is a bit young, because when they come off, I guess my worry would be if that mouth is still growing, if the teeth are still coming in. What's the danger of undoing all that hard work and indeed spend?
Fantastic. You already divided it very nicely. You mentioned preteens, and you mentioned obviously teens and adolescents. In the preteen group, there has to be a specific cause or a justification, I call it, for intervention. We go in, we fix it, and then we observe until the child develops and all the permanent teeth have come in. So in that age group, we anticipate some movement to happen. However, in the adolescents, we obviously give retainers at the end of it to help hold everything in place.
If you've got any questions, the text line is open, as is the phone line. If you fancy a chat, it's 048715500. Dr. Hakim with us today, consultant orthodontist at Same Day Clinic there on Beach Road. We've had questions about costs of both, timelines of both, which I think is a really interesting one. So if you've got anything that's on your mind, you want to get to the bottom of it, this is your chance. Totally caught short there doing Northern accent with Dr. Hakim. I'm absolutely not going to do my Geordie accent. And Dr. Hakim probably wouldn't do his Sheffield either. Dr. Hakim with us today, consultant orthodontist at Same Day Clinic. We are talking braces in that preteen and teen market as well. We're going to bust some myths. We've got loads of questions coming in for you, Doctor. Can we talk about timeline, I guess, of those kind of traditional, what I grew up calling train track braces versus Invisalign? Because message here saying, is it true that Invisalign is recommended for less severe malalignment? So can we talk about that and then the timeline?
Sure. The timeline is really related to biology. So, any force that's applied to a tooth, the teeth will react, and whether it's bialigners or brackets and wires, it's a biological process. What we found is that there are some instances where with aligners, the cases can resolve themselves even slightly quicker than with braces, because ultimately it's about compliance. So with aligners, if you're not wearing the aligners are not working.
Don't look at me like that. I'm trying my best. I just don't wear them in the afternoon when I'm talking. But so I'm doing Invisalign. It's taken a bit longer than I thought because I'm not that compliant.
But once again, if you are with Invisalign, during the whole process, you look the same. There are no dietary restrictions, and you have full access to cleaning your teeth. Whereas with braces, if we're not compliant, then we're obviously going to be restricted in those three areas. So once again, and since we are dealing with growth in the teen and the preteen age group, if we achieve the justification early on, then there is no harm in prolonging the treatment to help with maintenance. So once again, the whole paradigm shifts. Because now, once we put the braces on, the patients are asking, when am I getting them off? When am I getting them off? Whereas with aligners, they can get them off whenever they want to eat or whenever they want to clean their teeth.
I just think with kids, I don't know. I'm not sure I would trust my 9-year-old to be brushing the Invisalign and, Does a maturity thing come into play sometimes?
Yeah, it does, but again, I think that's one of those myths that we find, is that the most compliant age group is actually the teen group. We have children who play musical instruments. We have children who act in the school, theater group. We have children who play sports. So all of those would be more inclined to be compliant. And if you can put it on par with eyeglasses.
Good point.
Children, they wear eyeglasses. So again, it's all there. And in my practice, to reassure the parents, because my fees are the same for fixed appliances and aligners, I tell them that if the child is non-compliant with aligners, they keep losing them, I will downgrade them to silver braces at no extra cost. And in my 18 years of providing Invisalign service, I've done that 3 times. So it's
not bad.
Yeah, it's not bad.
We've had a message here from Tutu saying, my 13-year-old got braces about a month ago, followed all the advice about cleaning teeth, and the dentist recently said there's a plaque buildup and to quote-unquote brush better. Can your dentist offer advice? Should I book her in for an oral hygiene appointment? She's trying her best, spends ages cleaning them, and it feels like she's let the dentist down.
That's very unfortunate to hear. I think another misconception is that if you're seeing an orthodontist, it's very important that you continue seeing your general dentist. So the regular cleanings have to continue during orthodontic treatment. But perhaps she could use something called a plaque disclosing tablet, and this will actually stain all the plaque on the teeth. And it's a fantastic tool, and then that way you can focus more on the areas where there is plaque buildup.
Target. Hope that helps too. I'm going to summarise a few questions we've had in one go, which is, when should you see an orthodontist? So how early should parents be considering an expert such as yourself to treat their child, Dr. Hakim?
Sure. We should see the children, as the American Association of Orthodontists recommends, around the age of 7. Because this is an age in which the permanent teeth should have started to erupt or emerge in the child's mouth. It does not mean that treatment will be done at that time, because in the preteen group, we really have to have a justification. 2 children can come in, or 2 siblings. One is more concerned, the other is not, presenting with the same findings. You may treat the one that is concerned and not the other and wait. So it's very customized.
And again, to address a couple of messages, would you go and see an orthodontist direct, or would you need a referral from your general dentist?
I would always recommend that you do have a dentist. because I would not start any patient unless they were cleared by the dentist. So having no cavities, having good oral hygiene is a prerequisite to starting treatment. So I think it's very important to have that.
And I guess that's, isn't it, that's that kind of process, knowing the timeline, knowing what's in store, being able to budget for it, and all of that. What do you think we're going to be talking about in 5 years' time when it comes to orthodontics? What's happening in the industry or behind the scenes that we as patients might not know about that you're excited about, Dr. Hakim?
Well, the increased digitization, increased utilization of technology. I think now we are able to treat patients more remotely. I have patients as far as Cameroon, Afghanistan, Germany. So these are things that, 10 years ago were unthinkable. So I think it's very exciting. And our ability now to track the progress of patients remotely using tools like virtual monitoring and digital monitoring are incredible.
Well, thank you so much for coming in, breaking it down. As I said, a number of messages asking for your details. So if you want to send me the word, send me the word teeth. We'll make it easy. Send me a tooth emoji. And with your permission, Dr. Hakim, I'll share your details from Same Day Clinic. Would that be okay?
That'll be fine.
Thank you so much. Absolute pleasure. We have been talking Invisalign, braces. Dr. Hakim with us today, consultant orthodontist at the Same Day Clinic. As I said, if you'd like his details, send me the word teeth. Worst messages we weren't able to get to, but perhaps you'd like to ask him direct as well.